Your doctor mentioned a bone marrow transplant. Here's what the process actually involves, step by step. Bone marrow is the spongy tissue inside your bones. It's the body's blood factory, making red cells, white cells, and platelets. When marrow is damaged by leukemia, aplastic anemia, thalassemia, or similar conditions, it can no longer produce healthy blood cells. A transplant replaces diseased marrow with healthy blood-forming stem cells. Despite the name, it's given through a drip, not surgery. There are two main types. Autologous uses your own stored stem cells. Allogeneic uses cells from a matched donor. For a donor transplant, tissue types must closely match. A sibling is often preferred, but registries and half-matched family members also help. Before the transplant, conditioning therapy uses high-dose chemotherapy, sometimes with radiation, to clear diseased cells and make room for new ones. On transplant day, called Day Zero, the stem cells flow in through the central line. The infusion itself is usually quiet and uneventful. Over the next 2 to 4 weeks, engraftment happens. The new cells settle into the marrow and start producing healthy blood again. Hospital stays typically last 2 to 4 weeks for autologous and 4 to 6 weeks or more for allogeneic transplant, with close monitoring throughout. The main risks include infections, bleeding, organ effects, and, in donor transplants, graft-versus-host disease, where donor cells attack the patient's tissues. Recovery unfolds slowly. Blood counts rebuild first, then energy. Immune recovery can take a year or more, especially after allogeneic transplant. Long-term follow-up continues for years. Vaccinations restart, and doctors monitor blood counts, organ function, and late effects over time. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.